My priority is that there should be equity across the country, and where I live there is no long COVID service.
I still feel like there's times where I'm like, I don't know what to do. That's worked really, really well.
There's a lot of ignorance out there about long COVID, and there's a lot of people that don't understand how it is.
What are your priorities for long COVID care in the future?
What we need is a place where medical staff can refer us and they can look at us holistically, because we've got so many similar but different symptoms. We're getting a lot of, well, we don't know how things are going to pan out because this is all new to us and we'll just have to wait and see, but then that's leaving us all just hanging, waiting.
My priority is that there should be equity across the country, and where I live there is no long COVID service, and it's a bit of a postcode lottery. If I lived where I was born, I would have access to multidisciplinary long COVID support, but I have nothing where I live.
Also, research. There has to be research into this, why it is still, like, not just a few months after having it, but years and years after having it, severe symptoms. Why are some people feeling that they've recovered fully, which is wonderful news and gives us all hope, but why? Why have they recovered and others aren't recovering?
What aspects of your long COVID care worked well?
For me, what's really worked really well is I was blessed when I caught COVID the first time. I got to see a consultant. I've remained with that consultant, and they have a respiratory specialist nurse who contacts me like every single week now. It was daily. Just caught COVID again in October. My husband caught it first. I messaged them and they went, right, we've got a plan in place within 15 minutes. If you catch it, this is what we're doing. That has worked amazingly well for me to deal with the respiratory issues that are ongoing. But they're looking at me as a whole. They advocated for me to get some mental health support, and that support's continued.
I have had private healthcare through Dr. Claire Taylor, and that worked for me. It helped. It didn't fix it, but it kind of eased some of my symptoms, and again it felt like I was speaking to someone who knew how it was to be me in this situation. And the thing is, she keeps herself absolutely at the forefront of what the newest things are, and so she's using evidence-based healthcare with you, and she's really motivated to get help for you. But I think it's really wrong that I can get that because I can afford it, and people who can't afford it, it's a lottery.
From your experience, what could be improved?
And of course, as with everything, the investigations when they do the various tests and do blood tests, that kind of thing, well, it looks within the norm, but actually what was the norm for me before? I think we need medical people to start saying, okay, it doesn't matter what's in the norm, we need to be listening to the individual, to what they're saying. If it's not normal for them, what can we do?
There's a lot of ignorance out there about long COVID, and there's a lot of people that don't understand how it is to have long COVID. I am not the same person as I was pre-COVID. I think there's still a lot of misconceptions, and there's a lot of general public don't understand, healthcare don't understand, and I think there's a long way to go.
You know, we've got this message out that COVID's here to stay. We need to learn to live with it. Absolutely, we get that, except some people can't just get on with and live with COVID as everybody else says.
Even my closest family, I think sometimes don't quite understand that until they see me looking unwell. And it feels like that's quite a far way that I have to go to get people to understand. If I had a condition that was more well known, something like MS, I think there would be a lot more empathy and sympathy and understanding. But I think at times with long COVID, there's we're over COVID now, you know, and for those impacted by long COVID, we wish we were over it, we're not.